Good afternoon, everyone. As the days actually roll into the weeks and the weeks roll into the months, it could be possible for some of us to become complacent to the impact of this virus. But we must never let that happen, no matter how long this pandemic lasts, because we must always remember the devastating impact COVID-19 has had and continues to have on families right across Northern Ireland. Sadly, today we lost another 7 of our citizens, and as always, my thoughts and prayers go out to their heartbroken families and friends. And given the disturbing impact this virus has had on the physical and emotional well-being of our population, as this is Mental Health Awareness Week, I would like to take this opportunity to emphasise that mental health and well-being services have not stopped and are still operational. In many instances, support is being provided digitally using online tools and apps. However, anyone who needs help should contact their GP, a local community and voluntary group, Lifeline, or if it's urgent, contact 999. I am pleased today to announce the publication of the Mental Health Action Plan. The Action Plan contains 38 actions, including the introduction of a specialist perinatal mental health services, the development of managed care networks for child and adolescent mental health services, and forensic mental health services. In addition, there will be further support for mental health in primary care. The Mental Health Action Plan is the first in a series of steps I will take to ensure those suffering from mental ill health will be able to access the services they need when they need them. The importance of this has been brought into sharp focus during these unprecedented times, when the mental health of the population is suffering as a result of the devastating impact of COVID-19. That is why the Action Plan includes a dedicated COVID-19 response plan, which outlines the psychological well-being and mental health response to the current pandemic. The Action Plan provides links with other mental health improvement work and initiatives already underway, including Protect Life 2, and the response to Nicky's Still Waiting report. The Action Plan will also provide much needed clarity going forward and will set the firm foundation for the longer-term mental health strategy. In the meantime, alternative methods to help with stress have also been made available. Stress Control is a clinical-led service available online through a collaboration across the UK nations and Ireland. It is a 6-session cognitive behaviour therapy class and is available free of charge. My department is also supporting the HSC to develop and make psychological first aid available across Northern Ireland. It is accepted that those working in health and social care are under extra pressure. As I announced a number of weeks ago, specific help and support has been provided for them. This includes access to psychological support helplines, staffed by psychologists, a broad range of online resources, and drop-in services in critical facilities. I've also recently announced the creation of a mental health champion, and the purpose of the mental health champion is to further the mental health agenda across all platforms and fora to promote emotional health and well-being access to evidence-based support and services and promote recovery. The champion will also help us learn from the current crisis in the work going forward. From my very first day in the Department of Health, I have said that mental health was one of my top priorities, and that remains just as much the case. The messages I have repeatedly, endlessly from the start of this emergency are just as urgent and just as crucial today. I make no apology for sounding like a crack record. Keep washing your hands and keep your distance. Look after yourself, your families, and your health service. These messages are so important now that some changes to the lockdown restrictions have been announced. People will be out and about a bit more, including meeting family members and friends outdoors in groups of up to 6. Please remember, social distancing remains a matter of life and death. I can't emphasise that enough. Wash your hands like your life depends on it, because it just might. Because yesterday's announcements on changes to the restrictions was good news. It means we have made significant progress in the COVID-19 fight back. We can ease things, just a little. The pressure and the isolation felt by so many can be reduced, albeit slightly. But we must not throw away that progress now. Meeting close friends and family after so many weeks will be an emotional experience. We will instinctively and naturally feel like giving a hug or a handshake, Please don't. Please keep on keeping your distance, because there's too much at stake. We in the executive want to ease the lockdown further when the time is right and the expert advice says we can. All of this will fall apart if people don't stay on the right path. Flouting the public health advice will lead to the lockdown being tightened again, and it will put you and others at risk. And as important as advice is during this pandemic, I also realise that nothing trumps real action on the ground. We have carried out 64,000 tests for COVID-19, 50,000 within our own local HSC labs, and a further 14,000 as part of the national testing programme. On Sunday I announced we were now in a position to move to make testing available to all care home residents and staff. As of this morning, there have been 4,950 residents tested. That's almost 40% of the entire care home population. In addition, there have also been 4,816 of our care home workers tested. Detailed plans are in place for the scaling up and second phase of the Northern Ireland Contact Tracing Service. This will be informed by the learning from the current pilot programme that began on Monday the 27th of April. We have tested the processes for contact tracing, and as from yesterday, we have been undertaking contact tracing for all confirmed positive cases of COVID-19. The pilot programme has been operating on a 5-day week basis, but we are now expanding the service to operate over a 7-day week. This will be a major commitment, as we expect this service to be in place for the next year at a minimum. As an example, on Monday the 18th of May, we added 36 confirmed cases to the programme and followed up with 35 cases. Together, we can prevent the spread of infection and keep people safe as we move out of lockdown. In parallel with continuing to manage this crisis, I can confirm that the significant work is underway to rebuild our health and social care system in the wake of the first COVID-19 surge. Our immediate focus in the coming weeks will be on stepping up any urgent services which were paused as we prepare for that surge. But let's be clear, the system as we knew it has been permanently changed by this pandemic. This is not necessarily a bad thing. It was widely accepted that before the pandemic struck, there were fundamental flaws within our health and social care system. That position and the need for change was clearly set out in the Bangor report, which was accepted across the political spectrum. We know only too well that going into lockdown was much more straightforward than coming out of it safely, step by step. The same applies to rebuilding health and social services, but there's also an opportunity to improve the system for the long term. In doing so, we need at the same time to retain significant capacity and flexibility to deal with the continuing COVID-19 threat. That continuing threat will also limit what we can do in our hospitals. Keeping people safe means working to avoid busy waiting areas. That will obviously impact on how we provide services well into the future. Keeping people safe means separating COVID care and non-COVID care as much as is feasibly possible. That has been likened to running two health services in parallel with each other. This all amounts to a huge logistical challenge. It will require time and patience and ongoing funding because we have to get it right. In terms of the way forward, I can report today that trusts have already been tasked with developing service rebuilding plans for their respective areas. There can be no return to the way we were in December 2019. Why should we aspire to return to a structure that was widely accepted as being flawed, with unacceptable waiting times and a yawning gap between capacity and demand? We must seek to embed the sort of change we all know is needed and ensure that if the health service is not to fail the public, we must not fail the health service. So we must not go back to the way things were. We must embrace the important innovations that have been introduced in the midst of this emergency, and I'm thinking, for example, the use of telephone and virtual consultations for patients. Digital delivery will clearly be one of the pathways out of where we are now. We need to set our sights higher than a return to the old status quo. Rebuilding gives us an opportunity to transform our systems for the better. Thank you. I'll now hand over to Minister Murphy.
Dave Clare. Last week, the Executive published its pathway towards recovery. The Executive took its first step on this path yesterday when it announced an easement in some of the restrictions it imposed to protect lives. It's important that this process is coordinated across the island, and to that end, a meeting will take place between Ministers North and South this evening. Businesses and trade unions are now looking ahead at how they can resume trade in a way that is safe for workers and for the general public. To help with that planning, I today announced how the rate system will operate for the rest of the financial year. This £213 million support package builds on the £100 million scheme I announced in March. It will extend the 3-month rates holiday for all businesses by another month until the 31st of July. The sectors hardest hit by the pandemic will pay no rates for the full financial year up until the 31st of March 2021. This includes the hospitality, tourism and leisure sectors. It also includes retail with the exception of medium to large food stores and off-licences, which have continued to trade, albeit with higher costs. Food retailers have really stepped up during this period, opening their stores, making adjustments to ensure the safety for customers and staff, and we owe them a huge gratitude. I also want to thank the workers in these food stores who have continued to provide a vital service during this difficult time. The viability of childcare providers is severely impacted by their difficulty in maintaining social distancing. Therefore, they too will receive 100% rate relief until the 31st of March 2021. Our airports will continue to be adversely impacted for a considerable time to come. That is why Belfast City, Belfast International and City of Derry will also receive 100% rate relief until the 31st of March 2021. This brings the total support for business from rates relief and grants to over £700 million, demonstrating the Executive's determination to protect livelihoods and jobs. I'd also like to provide an update on further COVID-19 funding allocations announced today. This includes £30 million for infrastructure to fund pressures, particularly those faced by TransLink, £25 million to support farmers and the horticulture industry, with a further £3.8 million provided for DAERA for waste management, treatment and disposal. £20.3 million to local councils which have delivered vital services during the COVID-19 crisis. £10 million for the Supporting People programme, which supports approximately 19,000 vulnerable individuals living independently. £1.6 million has also been made available so that health staff who have shown exceptional dedication during this pandemic would not suffer a financial loss as a result of the strike action they took earlier this year. Funding has also been announced today for substitute teachers who are facing considerable loss of income, and the Executive also agreed to provide £1.4 million to support university students facing hardship. The further COVID-19 funding allocations today see our response package totalling over £1.2 billion to support our health service, vulnerable people and businesses at this challenging time.
Afternoon, Ministers. Enda McClafferty here from the BBC. First of all, for the Health Minister, why is it here in Northern Ireland up to 6 people from different households can meet outdoors while maintaining social distancing when that figure in England is just 2 people? Is it more of a risky strategy that we're employing on this side of the Irish Sea? And one other question, just Arlene Foster has said in the past that the Executive would provide a breakdown of the infected care homes in Northern Ireland to give us a sense of how many confirmed cases each care home in a sense has. Is that still the Executive's plan, and why we have not seen it up until now? And just a couple of questions for Conor Murphy, the Finance Minister. Some people have in the chamber today raised questions about your own party's attacks on the Health Minister, and some have suggested they have been unfair. What's your response to that? And when we have the two of you here, whatever happened to the PPE order from China, £160 million worth, has that now been scrapped?
And there were so many questions there, I've nearly forgot how many you actually asked, to be perfectly honest with you. And I'm being serious in regards to that. I know we've made a number of statements here in regards to a mental health action plan, which you haven't picked up on. In regards to 6 versus 2 in England or 4 in the Republic of Ireland, we looked at the number of 6 because it was socially acceptable. It looks like a reasonable group that we could actually manage. But what we will do is each step of the restrictions are eased and we step forward, we'll see the impact that they actually have on the spread of coronavirus here in Northern Ireland. So 6 was a number that we thought of. It's up to 6, doesn't have to be 6, it can be 2, it can be 4 in the same as the Republic of Ireland. But to look at that sort of granularity in regards to the restrictions is something that's a positive step we want to take, because we want to see a return to normality here in Northern Ireland. In regards to the publication of the data in regards to care homes, if you look to already, we've taken the first step in that on our front-facing dashboard, where we've put the number of homes who have a COVID-19, who are suspected COVID-19 and who are clear. We haven't went to the length of publishing the names of specific homes because we think that's unfair due to data protection, but also the pressure it would put on the individuals and the family and the staff in some of those homes as well. So I'll not be in the process of establishing a league table for homes in Northern Ireland at this minute in time. But the data is there for homes. And look, when you want to look at that dashboard, if you have, you will see with 33 care homes in Northern Ireland that are now COVID-free, that have had COVID outbreaks, that have went through the full process of eradicating COVID-19 in their homes, went through a full deep clean as well. So there are good news stories in regards to where we are with care homes.
Can I say in relation to your question, I'm not aware of the commentary in the Chamber today. I was in the Chamber earlier making my announcements in relation to funding allocations, and all was very positive, and camaraderie was very evident among all of the MLAs there. So I'm not sure who provoked such dispute later on in the Chamber. But can I say that our arguments in the Executive over this have been about policy matters. They have been about life and livelihood decisions that we have to make, which are huge challenges for this Executive. One that no one expected us to have to face with when we got back on the 11th of January. We already knew we were in a significantly challenged political atmosphere with the ongoing effects of austerity, with Brexit, with a five-party coalition, with a shortened time frame in terms of getting matters resolved. All those challenges were faces, and this pandemic came along. So to expect that a five-party coalition would embrace these issues without any dispute or disagreement among us was probably naive. I have to say, in relation to challenges to Robin, this is, as I say, about personality, or about policy rather than personality. I have a very strong working relationship with Robin, as I would consider that with all executive ministers, and we have worked very firmly together in range of all these issues. And our shared priority across the executive is to protect lives and livelihoods. That's what drives us. And in relation to that, as part of our joint working arrangement, we have pursued orders of PPE because we are conscious that whatever comes into Britain and whatever may come across to here, they have accepted that there are certain items they will not have. And given the scale of the issues that they're facing, particularly in the south of England, then they're likely to be very much challenged in terms of what provision they can make for us. So it's imperative that we continue to try and source our own PPE wherever we can, and we have done that, and we continue to do that, and we will make further announcements in relation to that whenever we have further announcements to make. But we have not given up in relation to securing PPE internationally to make sure that our healthcare staff on the front line get the adequate protection that they deserve.
Good afternoon, Ministers. Vicky Hawthorne from UTV. Firstly, for the Health Minister, Mr Swann, we were told last week that the Executive gets a daily update on what the R number is. Can you tell us what that is today, and is it what you would expect at this stage? Also, you have hinted and talked about for several weeks now how the health service can't go back to what it was. You heavily criticised how it was managed over the last 10 years by the executives over the last number of years. Will COVID-19 force you to make some of the difficult decisions that you said last week had been ducked over the last decade, including potentially closing hospitals? And for the Finance Minister, you've announced a lot of relief for business today. Should that come with a health warning, if you like, that we're all going to have to pay for this down the line?
Vicky, in regards to where we are specifically in the R number, we're sitting at this minute in time about 0.7 to 0.8. And I think we will look to producing a weekly figure rather than a daily figure due to the timeliness of that, to make sure we're not getting into a running daily commentary, but it is a weekly statement that can see trends as to the steps that we've taken coming out of lockdown and the effects that they're having. In regards to the changes that are coming in the health service, I don't think it was perceived and picked up that I was having a political attack. It was far from it. It was an admission that when we looked at ourselves in this place, as every health service across these islands looked at ourselves, the lack of underfunding over the last number of years had left our health service in a very precarious state. That's why we saw our nurses on strike. That's why we, as political parties in Northern Ireland, took the decision to come back, and we worked together to reinforce and reinvigorate the pay structures and the safe staffing measures that our nurses needed to come back off strike. And that was a big step that the 5 parties in the executive had to take. In regards to the difficult decisions, those difficult decisions will have to be taken. They were always going to have to be taken in regards to the reformation of our health service. But it's not about closing hospitals. It's not about closing buildings. It's about reprioritising and reinvigorating the health service we have so that we're delivering the services that people need. It may not be while we work through and come out of this recovery phase for the first surge and still leave capacity for a next surge that we look at reprioritising and relocating some central services while we start to work on our waiting lists, which were horrendous back in January. And they're getting no better now as we've had to suspend some procedures as we dealt with COVID.
Yeah, can I say that the announcements we made today bring in total to over 700 million of support for business. This is a proportion of the 1.2 billion that we've got from Treasury in response to the COVID challenge. And we have, by and large, prioritised that for the health response, because this is primarily a health crisis and a health challenge, to business and to vulnerable people. That's where the executive has prioritised that money. And of course, there will be challenges ahead. There is an overextension in some of that commitment, but I'm confident that we can meet that overextension in the time ahead. But it does bring us to the point where the point that Robin was addressing just in relation to his question. The reason that we've had to go into lockdown and the economic damage that will cause was to try and protect the health service, which has been, as Robin has said, underfunded for years, if not decades. And that was a programme of austerity that emanated from the British government to underfund all our services, but most acutely felt in relation to our health service. So the lockdown was necessary to make sure the health service wasn't overrun. That's why we're into these very severe, and the economic implications that will flow from that will be far-reaching and very challenging right across these islands. So I hope that it prompts a rethink, not just here, where we have limited resources, but a rethink in London, a rethink in Dublin in terms of investing in services, because the lack of investment has actually caused a longer-term economic damage as a consequence of that.
Ministers, good afternoon. Freya Clements, Irish Times. For the Health Minister, I wonder if you could expand a bit more on where we are in terms of contact tracing, and in particular on a cross-border basis. How is that working on a cross-border basis? Is it individuals talking to each other? Is the app part of that? And is that app compatible? Is it the same app, or are they talking together in terms of the language that's being used? And for the Finance Minister, just in terms of the North-South meeting that you mentioned, could you give some more detail on that in terms of potentially, are there specific areas that are being looked at where there might be North-South collaboration in terms of emerging from lockdown? Are you looking at the scenario, for example, whereby steps might be taken at the same time on both sides of the border?
Freya, in regards to the contact tracing, it's solely people. It's the personal touch. It's people at the end of a telephone contact and the positive case, and then tracing their contacts through that. So it does work. It's what we used at the beginning. It's how, if you remember, our very first case was an individual who landed in Dublin Airport, then travelled to Northern Ireland, back to their home, and we saw PHA and HSE actually working together to do that contact tracing. So we're taking that approach to begin with. In regards to the development of the app, we're still looking to see which will be the best fit for Northern Ireland, so we're keeping an eye on NHSX, and as they develop their app, I spoke with Simon Harris, the Irish Minister, this morning in regards to where they are in developing their app, and that will be part actually of our conversation this afternoon as well, as to how we make sure that any app that we use, should we have to use 2 apps in Northern Ireland while we develop our own, that it is critical that we use the technology to support the people in the call centres, the people on the other end of the phones. That's where our focus is at this minute in time, because we know that works.
Yes, as Robin says, this is one of a series of meetings. It was scheduled some time back for today. I know there have been conversations, as Robin has alluded to, between the health ministers and even between the Taoiseach and others in terms of ensuring that we are now cited in relation to each other's proposals. for coming out of lockdown. And there is a memorandum of understanding between both health departments, and my understanding from reports that I receive in the executive that there's an excellent level of cooperation across the border in relation to those health matters. It's key. I think you're a border dweller as I am. It's certainly key that there is clarity of message in relation to ensuring the public understand what we're doing, when we're doing, and what they're required to do. And the response from the general public right across this island to date has been exemplary. So I think it's critical, setting aside the politics of all of this, that we have as much cohesion, as much synchronicity across the island in terms of our response to that, so we get clarity of message, because there is a great fluidity of movement around the border areas and across the island generally. There's that movement, and as we continue to open up, and the business starts to open up and the economy starts to open up, that will increase even more so when people returning to work. So clarity of message is a key in order to ensure that this pandemic is kept under control and eventually suppressed. And I think in that regard then, the more cooperation and collaboration north and south on this small landmass, then the better for all of the citizens who live on it.
Good afternoon, Ministers. It's Michael McHugh from PA. This is just a question for the Finance Minister. Your announcement about the extension of business rates reliefs appears to have been fairly well received, but you made your announcement at the same time as record unemployment figures were released earlier this morning by NISRA. So are you not concerned that this is too little too late to save thousands of jobs? And have you modelled how today's announcement is likely to affect the long-term future of a lot of companies? Well,
we're about 6 weeks from that information was gathered. I think it's in relation to the March unemployment rate. So to say that it's too late to make, over that period of time, £700 million worth of intervention in terms of supporting business, I think is incorrect, at least. Of course, there's huge challenges here, and that's why the investments that we've made have been an attempt to keep business afloat in this very challenging time. The employee retention schemes and other schemes for self-employed, of course, are going to be key, and I had just finished a discussion with the Treasury in relation to those matters. And so we will do all we can to support business, because in supporting business we are supporting employment. The vast bulk of our interventions in terms of the 700 million we have invested has gone to small and medium enterprises, which are the backbone of the economy here, which employ the vast bulk of people who work in the private sector here. So we have to try and ensure that we keep those businesses supported, we give them the opportunity to stay alive during this pandemic, and that we assist them in a calm and in a measured way and in a safe way to return back to full economic activity.